quite as good. I'm sure it's getting better as it was when I had that one single dose. I was just curious as to why it would be so dramatic on the first dose, and then as I'm taking the regular product, it's taking longer to get to the same level.
I don't know. In other words, well, the activity on the eyesight is due to the dopaminergic activity. Phenylethylamine stimulates dopamine, which it's connected to the actually active. It improves eyesight. I don't know. Maybe what it is the first time it has a more immediate effect, and then it works more slowly over time. I don't know. I have no idea.
Well, plus that was a few months ago, so I did get older, so
Yeah.
that.
I think you had a birthday in there, right?
Slower response time.
Yeah.
So, Dr. Stefano, I've got a couple questions for you. I know maybe the rest of the people have some of their own questions also, but Clamex is a breakdown of two components.
Right.
And could you just break that down a little bit? The difference between the two, the Clamin and the Aflamax?
Yeah, of course. Clamin works more on the neurological level because it has a high concentration of phenylethylamine and some, for instance, mycosporin-like amino acids, which are MAO-B inhibitors, and some alpha phycocyanins, right? Aflamax is actually an extract that concentrates mostly alpha phycocyanins. So has mostly a very high anti-inflammatory activity, very high antioxidant activity, and the difference essentially is that each one has an activity, a different type of activity on stem cells. One apparently more on the neuronal level, PA, and the other one more on the somatic level, like fibroblasts. But apart from the stem cell activity, the Clamin works at the neuronal level, so it has a very powerful activity on depression or anything that has to do with the neuronal system. Actually, there's new discoveries on PEA, on phenylethylamine, because apparently now it's been discovered that has a very strong activity on the immune cells. It seems to have, it has receptors on all the immune cells and stimulates, therefore, as soon as it gets in touch with the immune cells like natural killer cells or T cells, B cells, and so forth, it activates them. It has also discovered as an analgesic activity, anti-pain, and that could explain some of the testimonials that I've seen recently on the fact that very painful conditions are solved quite dramatically, and also an activity on digestion, because it seems to stimulate the release of hydrochloric acid once it gets into the stomach. That's for Clamin. Aflamax, alpha phycocyanins, are really powerful anti-inflammatory and antioxidant. And so, frankly, actually, we've always used the two. I've always used the two extracts separately, and Clamax is the first time that I see them working together, and I'm actually pretty impressed by some of the results. Like, I don't know if you've heard of that testimonial of that lady from Australia who in 1 week resolved a big problem of broken bones in her neck and collarbone, and after 1 week she threw away the cast in their shoulder, started moving the arm, which was quite, I mean, quite surprising for me too. So, you know, somehow the two extracts together seems to be able to produce results even much more powerful than each one separately. So that's very good news for me too.
Wow.
I don't know if.
Yeah.
Dr. Stefano, could I just ask you about that point then? The kids that you've been working with ADHD, are they
Right.
just on the clamine alone?
Yeah. The study was done with clamine, yeah. But again, you know,
Okay. And
I'm sure that Clamax with the addition of Affamax can even be more powerful than clamine itself, even on ADHD or these conditions, because again, you know, all these conditions, although they are neurological, they also always have include some kind of like you know, inflammatory condition or oxidative condition. So somehow I'm beginning to think that the two extracts together are even more powerful than just the clamine, even on neurological conditions like ADHD or any other condition. But yes, the study we did and we published now in December was done only with clamine.
Okay, so would a dosage for a child with ADHD now be like what's on the bottle, or a half a scoop of powder a day, or do you have any guidelines specifically for
Well,
ADHD?
I would start with one scoop, maybe like half a scoop twice a day and see what happens.
Okay.
You know, one in the morning, one in the afternoon, and see what happens. And if it's, you know, if it's effective quickly, then maybe after a couple of weeks you can go back into just maintaining with half. If it's not enough, you can even try to double the dose and see, you know, at least for the initial phase for a couple of weeks.
Yeah, that's a question I did have, and I had a couple of people that asked that. The dosage, one scoop. Let's say 1 scoop, 2 scoops. What's the max, or what have you seen in dosage for specific, let's say MS or degenerative nerve issues?
Frankly, you know, it's a little bit of a new thing for me too, because
Right.
as I said, you know, I've never used the two extract together in this format, in this, you know, because there's another element here, which is the fact that, you know, you drink it. There's also the element of sublingual assimilation, which makes it probably more rapid and somehow more effective.
Right.
I would say always to start, you know, with as I said before, you know, half a spoon scoop in the morning, half a scoop in the afternoon, and see what happens. But for more serious problems like MS or Alzheimer or whatever, I would actually go probably with a couple, you know, doubling the dose, at least for, you know, 10, 15 days and see what happens. One good thing that I don't know if I reported this in Las Vegas, but one amazing result we've had, and we're going to publish the study in a few months. This is a study that was done by the National Research Center in Italy, and they tested clamine on Alzheimer. And what they found is not only that there was a reduction of 80% in the beta-amyloid substance, which is impressive already in itself, but what is really amazing, and they were really amazed by it, is that somehow clamine was able to change the structure of beta-amyloid so that it actually became non-oxidative, no damage. It turned into a beta-amyloid substance that doesn't do any damage to the nervous system because it managed to change the structure. Wow. Which is, you know, absolutely amazing for me and for the researchers themselves. Yeah.
I've got a question too. Wondered about the alkalinity of it. What range have you tested the alkalinity on the Clamex?
The what? The
alkalinity?
You mean acid alkaline?
Yes, yes.
Usually the algae has a pH around 6.4. So, but no, I haven't done any specific test. But it's what I know is that it's interesting that I remember I haven't done anything on the extracts themselves, but I remember many years ago some people tested the pH of urine before and after taking AFA. In that case, was only AFA, not extract, but and they actually reported results like pretty quickly normalizing the urine pH.
Oh, wow.
Good.
Yeah. So, but I don't know. That's all I am on in that area.
Dr. Stefano, it's Dory.
Yeah.
We've had a question from some people of Stephanie's group, the lady you're dealing with in Las Vegas from STEM Tech. Anyway, there's another company passing a rumor that there's limited harvesting availability on Klamath Lake, and that no company could produce enough Clamex to service a large network marketing company. Can you comment on the production capability if we with 1 million distributors, please?
Yeah, that is one problem, one issue. We're working on it. In other words, right now, yes, we don't. I mean, for the current need, we're okay. Clearly, if the like the company were to grow to, you know, as you say, 1 million distributors or something like that, then what we need to do is not that it's not possible to harvest. It's just that it needs quite a bit of an investment in expanding harvesting capability. So I've discussed this also with Rajen, and you know, hopefully we'll be able to have enough funds to increase the production capability. We're already working on it. We're tripling, you know, the harvesters, and we're trying to work to expand the capability. But in terms of being able to harvest enough for 1 million distributor, yes, it would be possible. It just needs money for the expansion of the harvesting capability. So if it's a I just finished. If it's a progressive growth, that probably shouldn't be a problem, because, you know, the more the business grows, the more revenues are going to be available, and therefore the more ability to expand the harvesting capability. Clearly, if you tell me, oh, I'm going to have 1 million people in 6 months, are you going to be able to provide for them? No. At this point, no.
So what is the current capability right now? How many distributors could we service?
I don't know. I mean, the Rajen was talking about moving to, you know, from 10,000 to 50,000 products a month. That will not be any problem at this point. The other thing is, we're talking about from now to June. So my goal and our goal is to be able, starting from next June, to have expanded enough capability that we're going to be able to have much more than that.
Okay, well that's plenty.
Oh yeah.
Okay.
That's good.
Dr. Stefano, I had Ken Pepperdine here.
Yeah,
I had a question regarding the Climax when it's mixed aqueous. How long is that good for?
Yeah, I've answered that on Facebook. I would say that no. I think if you mix it in a bottle or a water, it's perfectly fine throughout the day. I would just advise that if you keep it for 2-3 days, when you don't drink it, you keep it in the fridge. But even outside of the fridge, it's not going to go bad.
Yeah.
For 2-3 days. But I would still advise to keep it in the fridge, if it's more than 1 day.
So, Dr. Stefano, in marketing Clamex, I always like to know my competition. I know in your PowerPoint, you said no competition. What we have we have STEM Tech and the Cerulean product. What's the difference?
Yeah. Okay.
Ours and
Yes.
theirs, so we can have some ammunition here to.
Right. Right.
Yeah.
Right. Well, STEM Tech, I think, is out of AFA. In fact, now what they're doing is they're defaming AFA, trying to say that is toxic and all this crap. Actually, on this, I would say that I prepared a documentation and an article I submitted for publication on the microsystems issue, which is completely exaggerated by essentially professional and business interest of toxicologists. Anyway, I hope to make this available, quite soon to everybody, or if anybody's interested, I can send it privately.
Yeah.
I can tell you that there was one doctor, I don't know if you know him, this Dr. Fabricius, who was actually very vocal on this microcystin issue, and really was repeating some of the things of STEM Tech.
Yes.
And I sent him all the documentation, my article, and after 1 month he came back and said, yes, your argument is very compelling, and so he didn't have anything more to say. So that's just an aside connected to the fact that STEM Tech now is not doing any more AFA. I don't know what they're doing. I know they're in bankruptcy. I have no idea what they're doing, but certainly there's no competition there. For Cerule, what they did, it's very weird, but we did some tests on their product, and that's why I'm saying there's no competition. What they did is actually they took the original STEM Enhance, which personally I believe was a copy of my patent.
Yep.
That's why I'm meeting on the 5th of February with lawyers in the US to start an action against the violations of my patents. But apart from that, what they did is they took the STEM Enhance, which was a mix of 2 extracts, they say. In theory, one was an extract of polysaccharides, and the other one was an extract of this L-selectin ligand, whatever. I don't even believe anymore what they're saying, but in any case, they actually reduced the STEM Enhance only to like 40% of the product, of their current product, and the rest is spirulina and some other another thing that I don't know what it is. But so essentially, when we went to test, for instance, for PA or PC, which are the 2 major components, we're talking about there's less in STEM Enhance than in the whole algae of both. So it's like, I don't know, maybe I think we got like 1 milligram of PA, and very, very low. And so I don't know what they're doing, but it's completely different, and personally I think very ineffective. I don't know why they moved into spirulina. Maybe I don't know. That was a decision of the new owner, of Greg Newman, the son of the previous owner. But yeah, again, in terms of decisive molecules, there's no competition whatsoever. Then they may say, oh, spirulina also has an activity on stem cells. I have no idea. Maybe they haven't shown it yet, but in any case, has nothing to do with AFA and the amazing properties of phenylethylamine together with alpha phycocyanin. So
right.
I don't know if I answered your question.
Yes. Yes. Anyone else?
Okay.
Just one thing about vision, and this might help for Dory too, is that it has a lot of lutein in it, which is also good for vision.
Oh yeah. What did you eat? I didn't hear well. What does it have?
The Climax is high in lutein.
Lutein.
Oh, lutein. Yeah. It's got like 15 carotenoids actually. Lutein, zeaxanthin, lycopene, all the xanthophyls, cantaxanthin, astaxanthin, there's everything in it. Yeah.
Yeah, and lutein is normally prescribed for visual.
Yeah. And so is zeaxanthin as well. Yeah. Right.
One thing on a personal note, I live in a part of the world that's very dark and cloudy at this time of year, and people are very prone to seasonal affective disorder.
Right.
And I don't have it at all.
Okay.
That has really helped the seasonal affective disorder.
Great. Where do you live? Sorry.
British Columbia, on the coast.
Right.
So
well, my family my wife and daughter just moved to Wales, which I think is pretty similar to British Columbia. It rains all the time, but whereas here I'm in Italy, and this year is amazing. It's mid-January and it's spring. Something's weird. I don't know. I have my meadows full of flowers. It's crazy. I have no idea what's going on, but anyway, it's nice, but.
Well, we're in Ron Borsma here. I'm in Holland, Michigan, and we're the second cloudiest area in North America because of the Lake Michigan. We get a lot of clouds blowing over there, cold air blowing over the lake, and we got a lot of clouds. You go to Wisconsin, it's clear and cold. We get the clouds and the snow. So I'm wondering too, being at 74 years of age, a lot of floaters, particularly in the left eye, which is making it difficult to read computer screens with not enough contrast between black and white. I wonder if there's any experience with floaters improving.
With what? Floaters.
Yeah.
No, I don't know. I don't know about that. No, I have no experience whatsoever with that.
Any experience with the disease ALS, Lou Gehrig's? I have a brother-in-law just diagnosed, and he's dropping pretty rapidly in his speech, in his movement, his swallowing.
No, not specifically with that disease. I would say that in general, any neurological disease is going to be helped because there's so much activity on all the neurotransmitters, on the regrowth of neuronal tissues, on stem cells. So it's really a 360-degree activity on anything neuronal. So I would think that it probably would help that too. But, I have no personal experience with that specifically,
And listening to you a few minutes ago sounds like maybe a loading dose of 1 to 2 doses per day.
Yeah, if you have something like serious like that, probably starting with a couple of spoons, like 1 spoon in the afternoon and 1 in the morning, 1 in the afternoon for, the beginning phase probably would be good. But, even like half and half to start off, it's okay. One thing I want to say is this, because this is actually something that may be very relevant and it's counter-intuitive. And it's actually something that I discovered myself many years ago. I'll tell you this story. When I got in touch with the climathalgia at the beginning, it was 1992, and there was the company called Celltech, which was the most successful multi-level company in the 90s, and then they broke down. And apart from this story, but what they used to say, well, you start with 1 gram a day. You do 1 week. We're talking about AFA in general here, but you do 1 week, and then you move to 2, and then another week, and then you move to 3 grams, and so forth. And if something happens that you have some kind of cleansing effect, I don't want to call them side effects, cleansing effect, they would say go back, and let's say if you move to 2 grams and you have some cleansing effect, go back to 1 gram and continue another week and so forth, right? And I used that system for a while. Then one time I had a patient who was an ex drug addict, right? And he had a lot of health problems based on that. And he started taking the algae in this way that I instructed him, 1 gram, then 2 grams. And every time he would move to, I don't remember if it was 2 grams or 3 grams, he would call me very worried and say, oh, I'm having heart palpitations, So I would say, oh, well, go back down and, try another week at the lower dose, And this thing went on forever. Every time you would move to, to 2 grams or 3 grams or whatever, even after a month and a half, it still had the same thing. Then at some point I said, look, I think you probably need to just go to double the dose at this point, because maybe you just need an extra push to move to the other side. And of course, he was very worried. He said, oh, but what if I'm going to get a heart attack? I said, no, this is not going to give you a heart attack. Don't worry. Anyway, he did that, and boom, vanished. The heart problems were vanished. And actually, even recently, I had further confirmation. I've had confirmations all my life with this, but even recently, somebody from my Gallen called me and said, I'm getting like, I don't know what dose he was taking, maybe 1 a day or something like that, and I'm getting headaches, and then usually what it is the product Climax is going to bring up not new things, but old things that are latent, Yeah. And in fact, I asked him, well, have you ever suffered of migraines or headaches? Oh, yeah, I've suffered of migraines and headaches. I managed to improve them a bit, but I was free for 6 months, but this brought it back. I told him, double the dose. And 4 days later, he said, double the dose, no more headaches. And now he's confirmed the same thing. So it's something you may want to keep in mind if something happens and somebody gets stuck into some, cleansing or bringing back up some old stuff.
Yeah, in my field, we would call that retracing.
Yeah.
So, or a healing crisis.
Yes.
Yeah.
I know.
Yeah, but it's right. But it's interesting that really what is interesting is that usually, I know I'm making a strong assertion here, but usually it's the last time you bring up that thing, that problem that you had before. So.
Yeah.
So the patent, the story you mentioned in the PowerPoint, the story starts in 2002. The patent, and you mentioned something about the circulating stem cells in the human organism were increased by 60%. Is that right?
Well, yeah, it's concerned with the patent by DLT Cerule, right?
Yeah.
And so that was my actual criticism of that patent, which clearly now I understand it was all messed up and falsified to prevent any conflict with my patent. So they had to say all these things. First it was a polysaccharide, and then it was low molecular weight peptides, and then the other patent saying that it was the algae increased stem cells 60%, and then they make an extract that actually increased it 25%, and then now Drapeau changed this tune and said, oh, but we only said 25% because we wanted to be conservative. In fact, it was 40. So you really don't know what's going on with these people. So,
Dave Severson, you had a question.
Yeah, Dave, I have a chiropractor doctor that had stem cell surgery a couple of years ago. He was paralyzed from exercising, and he had stem cell surgery, and it worked for a while, and then it quit working. And now he's going to have another procedure this spring that takes his own stem cells and whatever they do. I don't understand it, but he was just wondering what the benefits of Climax would be for his particular situation.
Could actually be very good. I can tell you something that I had a story with a chiropractor in the US who was he had some kind of degenerative disease. I don't remember what it was, but it was so bad that he actually was ready to sell his practice and retire because he couldn't work. He didn't have strength in his hands, and just with the Affamax in this case, not even the both of them, just with the Affamax, he actually went back to work, no problem. He retained his practice and he was fine. So, yeah, I would think again that it could help.
Okay, thank you.
Great.
I have a patient currently. We just started him on Climax, and he has a condition. It's not ALS, but it affects the quadriceps only, the big leg muscles, and they're wasting away. And so he's just started a couple of weeks ago, so I'm eagerly watching that.
Yeah. One other thing is, for me, it's a little bit difficult because, you know, I get a lot of requests right now from many people for, you know, very difficult diseases. And Climax is performing great. I'm really, really happy for what I hear. But also, you know, usually what I do, I also, you know, I have a line of product that is bigger than Climax. And for instance, I don't know if I mentioned my patent on the new probiotics. Yeah. And you know, usually I always associate probiotics because I believe very much that, you know, at the root of many of these problems is the leaky gut syndrome, and so forth. So usually associating that gives another, you know, another important tool but you know, having said that, I'm really, really happy with what I see with Climax.
So Dr. Stefano, I have a quick question. I lost internet connection for a sec, so I don't think this has probably been addressed, but I've been asked about the grittiness. There's a bit that doesn't dissolve and it's quite gritty. Can you
just, what?
You know,
Quite?
It's gritty. It's like a little bit of like sand in the bottom of the glass. Can you explain what that is? Or?
No, I don't know. I've never seen it, but
okay. Am I the only one experiencing that?
I'll look into it. No, I'll look into it and see, you know, what it could be. But you know, right now, I don't know what it is.
I just looked into the base of the glass that I had, and there was some particles, but they've since dissolved.
Yeah.
Oh, okay.
Okay. Yeah. I'm wondering what it could be, but there's not really anything that comes to mind that could produce that. But yeah.
Well, here's a short question. The cream. Any ideas about when the cream may be released or what the plan is?
You mean the cream in terms of transdermal?
Yeah, transdermal. Yes.
Yeah, yeah. We're working on it. I don't know. Rajan said that it's probably going to be launched in September. The reason for that is because we also want to make like a machine in a package that is exclusive to iGallen, so that is not going to be confused, and that's going to take a little bit longer. But we're working on it, and you know, hopefully even before then. I don't know. One of the problems is, as usual, governments. You know, if you lived in a world with less bureaucracy, everything would be simpler. But you know, to authorize a new device, you have to go through the FDA and blah 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 and all that. So
yeah.
Unfortunately, it takes time. Yeah, that's where it is now.
Okay. Anything else? Anyone else? Dory, any questions? Anything?
Hey guys.
No, I'm good.
Okay.
Hey, Dr. Dave. John Gluckman here.
Hey, Dr. John.
I set the alarm properly and then I slept right through it. So I'm sorry I missed all your proceedings, but I'm glad to see this is taking place. And I don't even want to put my video on because I haven't actually woken up yet. But anyway.
Oh, come on.
Oh, God. Listen to you.
We're friends, John.
We missed you.
So listen. Hey, Dr. Stefano, nice to see you.
Hi, how are you?
Good.
Hi.
Listen, my question for you is, as you know, I think I've talked to you before about this. My mother has, she's 92, and she has pretty far advanced dementia. And the challenge that's occurred in the last 2 to 3 months, which is really being a challenge because I didn't understand what it was at the beginning, was every day, around 4:30 and all the way up to about 7, as the sun is going down, and she started developing all these symptoms, irritability and nausea and confusion and need to be with somebody, just couldn't stay alone, and just terrible. So to the point where I just didn't know what to do with her. And then, of course, I took her to the doctors and did all the blood tests, the urine tests, nothing, perfectly healthy and normal. Then they threw the word sundowning. Now, are you familiar with sundowning syndrome?
No.
So when you actually look at it in the medical dictionaries
Okay.
and Wikipedia and whatever, it's basically a situation that is known and documented. So when the sun starts going down early in the winter days, the dopamine levels start dropping and the melatonin level starts rising to prepare a person for sleep. And those two combination of the chemicals set up this set of syndrome of symptoms that is very well known and established around the seniors communities in various living situations in assisted living. And it's just a crazy time. And I'm just wondering whether you think that the Climax may be useful, and if so,
absolutely yes.
Yeah.
And would you apply it just like early in the morning or in the afternoon before this?
You can actually do half dose in the morning and half dose around 4 o'clock or something like that.
Yeah, but okay.
Or dissolve one dose in one half a liter or less bottle and drink it throughout the day. I don't know. I mean, I don't know if your mother is gonna do that, but
no, but she'll do whatever I ask her to do because she's very compliant. She's not aggressive, and that's all. Debbie,
I would think the best thing would be half a dose in the morning and half a dose around 4 o'clock just before the thing happens.
Okay. Well, I'll definitely start today and see if it makes a difference.
And tell me how it goes. I'm interested.
Yeah, of course. Yeah, good.
Okay.
All right.
Okay.
One thing that I got curious about is I've experimented myself with mixing a small dose, fairly concentrated, and just holding it under my tongue, because there is some absorption direct to the brain. I understand.
Right.
And I wondered if there was any space for, I know the naturopaths use pearls that they'll put under their tongue, and I'm wondering if there's any space for Climax type of pearl that you can hold under your tongue.
Okay, maybe I didn't understand fully. What the space for what? For
a small capsule or concentrated form of.
Oh, I see.
That you can hold under your tongue and dissolve.
Yeah, the only problem with that is that I mean that's possible. The problem is how can I say this? Not many people like the straight taste. If you make a capsule of because if you make a capsule of this format right now, there's much more. I mean, out of 4 grams, the actives are 1 gram, and there's 3 grams of things like banana, cocoa, and so forth. Yeah. So if you put in a capsule, there's going to be very little of it. If in this form, if you put a capsule of straight Climax without any addition, then it probably would work. The only problem is taste is not the same, and not everybody likes the taste. Right. In fact, I would say most people don't like the taste of the algae, and also, again, putting powder like that directly under the tongue may be a little bit, like create some kind of, I don't know how you say, but it's difficult to dissolve.
Yes.
So we do have one product in drops, for instance. In Italy, we have a product that is Clamine in drops, right? Yes. Mixed with a little bit of apple and so forth, or mint as a mint taste. And that's already better, but that's only for Clamine, and it's a product that we have. So I personally would think that if you do, that's part of the thing is, if you dissolve the Climax in a bottle of water and then you drink it slowly, keeping it, under your tongue, you
Yes.
still have the sublingual effect.
Same effect, yes. Oh, so that's good. Yeah.
Yeah.
So on that same line, I guess, then how much water are you talking? Does it matter that much? Whether it's
No, I don't think so.
16 ounces or?
How much is 16 ounces?
Half a liter.
Yeah, half a liter. If you put like one dose in half a liter and drink it throughout the day, that's fine. But again, if you want, the other thing is if you want a more immediate effect at the sublingual level, maybe you want to dilute it less. What you can do, you take half a spoon, a scoop, and maybe dissolve it in, I don't know, 1 ounce or something like that, and keep it under your tongue and drink it like that. That depends how you wanna, what kind of effect you wanna have.
I have a testimonial on that. I did that and before bed, and I went to bed and I had a pleasant dream about my first wife, which is beautiful.
Uh-oh.
Is that a problem or?
Oh, it's nice.
It's a revelation.
Yeah, one other thing I want to say is that I said it before, but again, PA is not a stimulant, so it really actually helps even with sleep. And I've seen cases of people who had chronic lack of sleep, and they actually resolve the problem. And again, dreams also is another, more vivid dreams is something that also people experience. Yeah. The only thing I said also today on Facebook was that sometimes with some people who are, let's say, very edgy, very stressed out, very tired, they may get like at the beginning kind of too much of a buzz and they may not sleep or something, but that's not because of the product causes that. It's just that your body is so blocked that somehow the push that the product does, you're not able to handle it. And so that's why usually with people who are like that, I would say, maybe for a week or so, just take it morning and early afternoon. And then after your body has adapted to it, you can take it just before going to bed, no problem. It will help you sleep better.
I have a quick question. You know how with many men, they have the hypertrophy of the prostate, and that keeps them up or wakes them up 3, 4, 5 times a night because of urgency to avoid the bladder. Is there any chance that this would help that in any way?
Yeah, I don't know. What I know, I've had a few cases of prostate that were helped with by Affamax. So somehow, that could help. I know that I've seen a lot of cases in which kind of kidneys functions was improved. So yeah, I wouldn't exclude that, but I cannot say specifically if Climax is going to do that again because I've never tried this specific product on it. But yeah, I would say probably it should help.
So with respect to that, and going along with what Dr. Ken just said about sleep, would it make sense in that case, if you're trying specifically to try and address that, to take the full dose just before going to bed so that it's operating more at night than during the day?
Yeah, you can do that. I would just say, again, do it maybe after 1 week just to make sure you're not going to have a counter effect. But after that, yes, you can take it before going to sleep, and you sleep certainly better. And possibly, I don't know, it'll be interesting to see. You may even endure more the fact of having to go to the bathroom. Yeah. Okay.
I thought it was safe to bring that up around the guys, including Debbie.
Well, Dr. Stefano, I wanted to tell you that I'm very impressed with your responsiveness on Facebook.
Okay.
That's very unusual to see, and I want to say thank you.
Thank you very much. I appreciate it. Thank you.
Yes, thank
Okay.
you very much. This is wonderful.
Thanks,
Well,
Donald.
one other thing is I want to tell you is that if whenever you want to do other meetings at this time is perfectly fine, as long as you're not gonna get me up at 3:30 in the morning. I'm available.
What time is 8 p.m. Eastern in Italy?
Sorry.
8 p.m. Eastern time. What does that translate to Italian time, Italy?
Yeah,
9 hours.
It's 5 o'clock in the morning. Yeah.
Are you
9
up that early or?
No.
No.
Okay.
Hey,
Well, I mean,
No,
if
no,
it's something important, I can get up. But again, you know, this is a much better time.
so Dr. Stefano, I have you scheduled February 10th on Saturday.
Yeah. Okay. I'll actually be on Klamath Falls, so there'll be no time problem.
Perfect.
Oh, no.
Okay.
So I'll be sending an email out to everyone, all the docs and the health professionals. Let them know February 10th, and sounds good.
Great. Okay. Thank you very much.
Appreciate it.
Thanks, Dave, for organizing this.
bye-bye.
Thank you, Dr. Stefano. Good night.
Thank you.
Thanks so
Bye-bye.
much.
Good night. Bye.
Guys, 8 o'clock Eastern would be 1 o'clock in the morning for Dr. Stefano, or maybe 2 o'clock. It's a 6 hour difference from the East Coast to Rome.
Just on a housekeeping matter, David, if we get another physician or healthcare professional that we'd like to sit in on this call, can we share that?
Oh yeah,
address?
we're going to put an email out. I get a list of a lot of the docs that have signed up. I guess we have about 22 of them, and we're going to send an email out to all those, and then for next week, invite any of the health professionals on for next week. I'm going to try to get Dr. Ahrens on. I'm in the process of contacting him, and maybe I need some help from Dr. John to help me with that.
Sure.
In contacting him, but
Okay, I'll do that for you.
Great.
Hey, and of course the whole purpose for these kinds of calls is not only to talk amongst ourselves, but to bring in new potential people
Yes.
that are not in the business yet to understand what it is that we as a group have and they don't yet.
Yep.
So, sure.
Very good.
All right.
So Dave, I'm just wondering what your time is like at about 5 p.m. on Wednesdays. I think Ken and I may have a question or two for you coming up sometime down the road here.
5 p.m. I'm just getting through with some patients, but if I know ahead of time, I can plan it.
Okay.
Yeah.
Well,
By the
good.
way, Ken and Ron, how what kind of feedback did you get from the last week's call?
I didn't have any.
Oh no!
It was